So today we're going to demonstrate how to change a sterile dressing. And so before I would ever come into the patient's room, I would have checked the chart, and I'm checking for things like, do they have an allergy to any kind of tape? Do they have an allergy to any other dressing types that they may have? I also want to see if there's any limitations about positioning the patient that I might need to know. Other things that I might check for when I come in and I introduce myself to the patient, I'm also going to identify my patient by their armband, but I'm also going to have them tell me what their name is. And once I've identified my patient, I want to go ahead and tell them what we're going to be doing, that we're going to be changing this dressing. And then I want to ask the patient if they need anything for pain. And if they should need something for pain, then I'm going to go give the pain medication, and then I'm going to wait the prescribed time for that pain medication to take effect before I come in. So we've done all that, and we've given the patient a PO med, and we've waited our 30 minutes, and we're coming back in to do our dressing change now. So the first thing I want to do is, after I've done my hand hygiene, I want to put on my non-sterile gloves because I want to take this dressing off. And as I'm taking the dressing off, I want to make sure that I'm pulling on the tape toward the wound instead of away from the wound. And sometimes the tape may be adhering to the skin really well, and sometimes I might need to use some type of solution to help decrease that and keep it from pulling on the skin so much, especially in the elderly patients whose skin is already very fragile. So I want to take the tape off toward my wound. And I'm going to try, when I go to take the dressing up, to get all of the dressing at once. So I'm going to pick it up, and as I pick it up, I am going to look at my dressing. And the thing I'm looking for is, number one, is there a presence of drainage? And once I decide there is, then I'm going to look at how much drainage there is, what the color is, what its consistency is, and if there's any type of odor that it might need. And so once I do that, then I'm going to take off my non-sterile gloves. I'm going to try to keep that dressing inside the glove to kind of contain it. And then once I've taken my gloves off, I will put it in whatever receptacle that your hospital or place that you're working requires, whether it's biohazard or just the trash. And I have a trash can right down here, so I'm just going to place it there. Then I would do hand hygiene again, and I'm going to then look at the wound itself. And things that I'm looking for in the wound is its staging. I want to look to see if there is presence of granulation tissue, which is the red, really healthy looking tissue that's forming there. If there's any eschar, necrosis, tunneling, anything like that, or if there's even more drainage inside there. Then after I've measured it, both the width, the length, the width, and the depth, then I'm going to look at the tissue around it to make sure that that skin is staying intact and not have any other issues with that. So once I've addressed the wound and I've addressed the drainage, now I'll begin to open up the materials that I'll be using for the dressing change. And for this type of dressing change, we would use 3 packages of 4x4s, an instrument package, an ABD pad, and then of course I would need my sterile gloves and my tape in solution, because this is a wet to dry dressing, and so we would need some sterile solution to do that. So anytime I'm about to open sterile equipment, I always look at the package again, make sure it hadn't been torn, hadn't been opened, hadn't gotten wet, and that the expiration date is appropriate. Okay? And so once I've done all of that, then I'm ready to open up my equipment. Now, one thing you have to remember in sterile technique is you want to try to keep your sterile equipment within your line of vision. So I never want to turn my back to my dressing change materials, and then also I don't want anything to go below my waist. So those are the things I'm going to try. And once I've opened these packages, I never want to reach back over it without my sterile gloves on, because then I could be contaminating them. So you have to think about that when you're getting ready to open, so that I want to open from this end of the table to this end, because I'm going to open with this arm, and so I don't want this arm to go back over anything that I've just opened. Okay? Any questions about that? Okay? So with these 4x4s, sometimes they can be a little tricky, so I suggest getting them started a little bit before you lay them down. And so if you get it just a little bit started, then you can lay it down, and with your fingers of this hand spread out, you can hold it tight And then with this hand, you can open up the packaging. And when I open that packaging, I hopefully want it to stay open and not flat back over on top of my dressing. Okay? If at any point some of your dressings, when you open it, they tore, then I would stop right there and have to say I need to get a new 4x4 because they would be contaminated. Okay, so now I have all my equipment opened. The next thing I need to do is to wet 2 of the 4x4s because we're going to use 3 4x4s to clean, and then we're going to pack with the other moistened 4x4s. So one of the things I need to look at is my solution, my sterile saline or whatever solution we're using, is to make sure it's within date. Some institutions, you just use it and throw it away. Some, 24 hours, and so you want to make sure it has a date and a time on it, if that's the policy of the hospital. Okay? So one thing I want to think about as I'm pouring this is I want to visualize these 4x4s as their individual cell. I don't want my bottle going over any of the 4x4s and contaminating it. And I want the label of the bottle to be in my hand. So when you remove the top of something that's sterile, you don't want to put it down on your table like this. You will contaminate it inside. So you put it up and you put it onto your table out of the way. And now I can pour my solution. So I'm going to go straight into this 4x4, and I'm going to do about a quarter size solution. Then I'm going to back out, move over, and do the second one. And then I'm going to back out, reach for my cap, put it back on, and then I can set this off of my field.
So when you first open a sterile saline, you don't have to lift it?
It depends on the institution that you're at. Some institutions say that, some institutions say no. So you just need to check those policies before you do that. Okay, and so now everything's ready. I've done my hand hygiene. I'm going to put on my sterile gloves, and you put on your sterile gloves just like we've done before. Okay, now I'm ready to clean my wound. And so I'm going to pick up one of the 4x4s. And I don't want to reach over that one. And then you're going to fold it in such a way that you can make a point out of your 4x4. Because I'm going to clean from the top to the bottom, straight down the middle of the wound first. And so I don't want my fingers being contaminated with the wound, so I want to make sure I have it at point. And then I can go straight down the middle from top to bottom, cleaning the wound. Then I want to come around, I have a trash can right here, and I just want to drop it because I don't want my hand to go below my waist. Okay? And now I can get the other 4x4. And now this time I want to clean the side away from me. And when I mean the side, I'm talking about the side of the wound, not the side of the skin. Okay? And you want to try not to reach over this area that I've just cleaned down the middle first. And so sometimes you kind of have to reach across. And I'm keeping my field and my vision. And so the side of the wound, inside the wound, come out, get rid of it. And then the last way or side will be the side closest to me. And so you do the same thing. You just have to be cognizant of where your fingertips are so that you don't touch any of the wound. And then come down on the side closest to me. And then at this point, I have to look and see if there was a lot of solution. If it had gotten on the skin on the sides, then I would need to have dried that off. But we don't need to do that because we kept the solution all inside the wound. So this last 4x4 that has been moistened, we are going to actually pack with, okay? And so some books call it fluffing, some call it twisting, and we're just going to contain our dressing in a way so that we can pack it into the wound. Because the purpose of packing the wound is that as this is moistened and as it's drying, it will debride the wound, which is what we want because we want that red granulation tissue. Okay, so then I can reach across here and get my forceps. Okay, some people like to use this end to pack and some people like to use this end. It doesn't really matter as long as you keep everything sterile. And I think your sheet says to pack it top to bottom. And so sometimes I'll use the tips of these to get it started. And then sometimes then I'll switch and use the blunt end. And I'm packing it such that it will fill the wound up. Now it's not going to fill this wound up because we're just using this for demonstration purposes. But if you had a really large wound, you would need to make sure that it filled the whole wound up. Okay? Now if any of this had flopped over on the side, then I would need to cut that off because you don't want to pack that back into the wound. And then I can get rid of these 4x4s, but forceps. But because they're sharps, I can't throw them in my waste can. So I'm just going to set them over here until I can get to the sharps container. Then I have two dry 4x4s that I'm simply going to place over the wound. Again, keeping my fingers from touching anything. And then I'm going to use an ABD pad. And you'll notice on the ABD pad there's a blue line that covers. That's for radiography purposes, x-ray. And so you want to make sure that it's out, pointing out. And it doesn't matter which way it goes, just make sure it's on the outside. And then I'm going to place that over the dry 4x4s. Now at this point, if I'm not in isolation and there wasn't a lot of drainage, I can take my gloves off so that I can tape the dressing. And that's what I'm going to do here. And then I have my tape. And the way you tape this type of dressing is what they call a window pane. And so I'm going to tape all 4 edges of the wound. And I just simply try to measure about how much I want. I don't want too much tape on the patient's skin, but I need enough to make sure that it adheres to their skin and keeps it in place. And as I'm doing this, I'm going to talk about some of the things that you would document. Would be things like, remember when we assess the drainage? So you're going to document all of the characteristics of the drainage. You're going to document all the characteristics of the wound, the depth, all of those things that we assessed earlier. You're also going to document what type of dressing we did and the time and date, and then how the patient tolerated it. Okay. And then lastly, you want a piece of tape with the date, the time, and my initials on it, and that's so that the next person, or they know when the dressing has been changed and they know when it needs to be changed again. And most of the time they're changed once a shift, but if they get really soiled or there's other situations going on, then it may need to be more frequent than that. And this will let someone know. And you never want to write on the patient, so you write on the piece of tape before you put it on there. And then you cover your patient back up, get them back in a comfortable position, clean up your materials, and document.